Cancer patients receiving chemotherapy treatment might be at risk of developing a potential side effect that can result in loss of limbs and eventually their lives. This condition, known as lymphedema, can appear in some people during the months or even years after treatment ends. Lymphedema therapist Carrie-Anne Digans, who visited Grenada recently, said this side effect of chemotherapy is not widely known by cancer patients. She said the condition is characterized by a buildup of excessive fluids that circulate throughout the body. This fluid, at normal levels, remove waste, bacteria, and other substances from tissues. However, in excessive amounts, it can cause swelling in the arms and legs of patients. Ms. Digans called on the regional medical experts to start collecting data on this condition.
Sorry to say, our Caribbean brothers and sisters, we need to get our data collection down. And the States has over 10 million people who are affected by lymphedema. And that's lymphedema, which is cancer related. In Guyana, there is also lymphedema. It is known as filariasis, but that is lymphedema brought on by the infection from the mosquito. So we also call it elephantitis in the leg. So that is a form of lymphedema.
The therapist has also cited the lack of awareness on the issue as another hindrance to managing lymphedema cases.
Most people who go through cancer treatment from surgery to chemo and radiation are unaware of lymphedema, which is the pooling of fluid within the limb. So if it is a breast cancer patient, they develop swelling on the side that they've had surgery. And once they've developed it, if it's not caught early enough, it's for life.
Digans said that sadly, patients are often admitted for treatment in the late stages of lymphedema, which makes it difficult to reverse.
I normally would see people in the later stages of lymphedema when it is that it's maybe very rare to get a reversal, or if it's so extreme, my only real focus is how can I help this person to at least get range of motion, because once the limb, let's say an arm patient, is so heavy, it affects their gait, so you find that they literally lean forward, they're not able to move their arm, so it affects how they're able to do just basic things, like can you imagine not being able to brush your teeth?
The lymphedema therapist says her main focus is to continue to generate awareness on this important medical issue and therefore hopefully help decrease the number of cases in the region. For GBN News, Raquel St. Clair.